It is estimated that up to 80% of individuals will suffer from an episode of low back pain during their lifetime, and lumbar disc herniations are one of the common underlying issues. In this video, we will dive into specific herniated disc exercises that you can do at home. Disc herniation most commonly occurs in the lumbar spine and involves the displacement of disc material beyond the intervertebral disc space. In the most simple terms, the spine is made up of individual vertebrae stacked on top of each other. Between each vertebra is an intervertebral disc that provides a cushion so the vertebrae don't rub together. Furthermore, these intervertebral discs have a gel-like material inside called nucleus pulposus. A herniated disc is when that gel-like material ruptures through the outer layer of the disc and can press on the spinal cord or spinal nerves, resulting in symptoms including back pain and other symptoms that can make everyday activities difficult to perform. Low back pain is typically the first symptom of lumbar disc herniation. Often this pain will last for a few days and then subside, but leg pain, numbness or tingling, and weakness of the lower extremity often follows. Typically, the leg pain eventually travels below the knee and can even affect the ankle and foot. Most patients with a lumbar disc herniation will improve gradually over a period of days to weeks, with most patients being symptom free within 3 to 4 months. We have included many extension type exercises from the McKenzie method as well as core stability exercises. If any of these exercises cause more pain, please stop and see your physician. Number 1 is standing extension. This standing extension exercise helps reverse what you do on a daily basis. Since most bulging discs and herniated discs are caused by poor posture and repeated flexion of the spine, this stretch helps push the disc back to neutral position. So how to do it? Begin this exercise by standing up with good posture. Now take both hands and place them on both sides of your lower back. Now with the help of your hands, push your pelvis forwards and extend your spine back. Follow the extension with your neck so that you end up facing the ceiling. Start with 10 repetitions and do 2 to 3 sets. This one is particularly great to do when you need a break from sitting at your desk. Number 2 is cobra pose. The cobra stretch helps to push the disc material back towards the center of the intervertebral disc to allow for improved healing. The goal of repeated lower back extension is the centralization of symptoms, which basically means pain that travels down the affected leg to the foot should come back up closer to the lower back, which will in turn alleviate the pain. So, how to do this? Begin this exercise by lying on your stomach in the prone position and slowly press up on your hands while keeping your pelvis in contact with the floor and lower back relaxed. Hold the prop up position for 10 seconds. Aim for 10 repetitions of this stretch. Eventually, try to hold this pose for longer if it feels good, that is 20 to 30 seconds. Number 3 is cat cow stretch. So, how this helps? This is one of the most popular herniated disc exercises. By combining two yoga poses, the cat cow stretch can help to relieve pressure on the herniated discs by opening the intervertebral disc space. It also improves mobility of the spine, which may help to relieve disc herniation pain and speed recovery. So, how to do it? Begin this stretch on your hands and knees. Inhale and let your stomach drop towards the floor as you look up towards the ceiling. Follow this by exhaling and slowly rounding your spine while pressing into the floor with your hands and slightly curving your neck to look at your feet. Aim for 10 repetitions of this stretch and do 2 to 3 sets. Exercises number 4 and 5 are meant to help stabilize and align your spine so that you don't get herniated discs in the future. Number fourth is bird dog exercise. This is a great exercise to improve core strength and lumbar back muscles. So how to do it? Begin on your hands and knees with your hands positioned under your shoulders and knees positioned under your hips. Brace or contract your core as hard as you can before beginning any movement. While bracing your core, raise your left arm and reach it forwards until it is aligned with your torso. At the same time, kick your right leg backwards until it is aligned with your torso. It is important to not arch your low back as you do this. Hold this position for 2 to 3 seconds before slowly returning to the starting position. Repeat with your right arm and left leg. Alternate sides for 10 repetitions. It is important to note that you should only extend your arm and leg to where it's comfortable and don't arch your low back. Number 5 and final exercise is plank. This exercise is ideal for strengthening both your deep core and glute muscles. So how to perform this exercise? Begin lying on your stomach with your forearms against the mat. Engage your core and lift your body so that you are resting on your forearms and toes. Ensure that your spine is in a neutral spinal position, that is, it's not sagging in low back or lifting butt in the air. Hold the plank position for 20 to 30 seconds, then lower down to the floor. Aim for 2 to 3 repetitions of this exercise. Ensure to keep your back straight throughout the entire exercise. While you may be tempted to spend your days in bed or on the couch for fear of aggravating your disc herniation pain, you shouldn't. Performing these herniated disc stretches and exercises allows you to take a proactive approach towards your recovery and may help to reduce your symptoms and increase the overall health of your back.